I have an interesting case coming up as far as custom facial implants, and it will be the most facial implants that I've used to date in terms of a single operation. There will be 8 facial implants being used. And this is a young man who is interested in improving balance in his mid-face and his lower face, as well as forward projection asymmetries. In this case, we will be using 4 implants in the tear trough and the infraorbital region into the malar region. We'll be using 2 implants on each of the jaw angles and 2 hemi-implants in the chin. So let's sort of break this down. It sounds like a tremendous number of implants, but these 2 implants are usually 1 implant broken into 2. And the reason we do that is because we have small incisions that we work through to place these rigid implants. Silicone implants can be beneficial because you can bend them and you can squeeze them into smaller spaces, but they don't feel and act like actual bone, and there's other issues that we can associate with silicone. As far as polyether ether ketone, or PEEK, these implants are a little bit more rigid, and to compensate for that, we usually break them down. In this case, I've designed sort of a puzzle piece interlocking connection between the 2 implants, and that assures me that these 2 implants, when they're put into position, are ideally related to each other. So this implant is broken into 2 so I can place it through a subconjunctival incision underneath the eyelid. And by breaking it into 2 pieces, I can place it easily through a smaller incision. This implant will be used to augment the infraorbital rim and its sidekick here for the malar bone. And when these 2 implants are placed together and optimally positioned, they literally snap into the ideal place. So I can almost place this ideally without looking. I use my fingers to localize the ideal positioning of the implant, and because of that puzzle piece connection, they fall into place together. So this is how I can get a large implant in through a small invisible hole underneath the eyelid. The same is true for the other side. On the other side, the implant is a little bit smaller because the patient has more projection on this side. Finally, for the chin, we have a similar situation. We've seen chin implants quite often since these are placed under direct visualization. I don't really need any puzzle piece keying of the 2 devices. They kind of snap into position together. And in this case, this is going to address a generalized setback of the chin, as well as chin prominence asymmetry. The right side, for example, is a little bit more projected than the left side. The left side of the face in general is slightly larger in this individual. Finally, the same is true with the jaw angle implants. Jaw angle implants, like you've seen in the past, rather easily snap into position and oftentimes require as few as 1 screw to fixate it into optimal position. With all of these 8 implants, I expect a subtle but important change in this young man. Thanks for watching.